Patients were coming in that were very symptomatic, and the physicians would not test them. And I tried to educate the staff and the physicians. I worked at a teaching hospital, and they wouldn't test the people.
Pediatrician Dave Carr was told he was suffering from a rare, incurable neurodegenerative disease. He was about to die, demented, blind, deaf, and in a diaper, before he was correctly diagnosed with a vitamin B12 deficiency, a condition that would have been easy to prevent and inexpensive to treat if it had ever even crossed his mind. Dr. Carr did not know that low B12 was shrinking his brain and demyelinating his nerves. He did not know that masked B12 deficiency damage can look just like MS or Parkinson's or Alzheimer's or autism.
There's no way in the world in the year 2005 that a vitamin deficiency can do something like this.
And yet, B12 deficiency causes serious problems ranging from fatigue to depression to memory loss to heart disease. What your doctor doesn't know about vitamin B12 can hurt you.
Low B12 levels are associated with a progressive cerebral atrophy.
It's not a placebo.
The neurological manifestations well precede the hematologic manifestation.
Well, let me simply say you can't live without it. The vitamin B12 deficiency, if left untreated, results in death.
I'm now having to basically go half days and have to go home and literally sleep.
I don't remember the point that I stopped remembering things.
He was in the gray area. He was below 5 percentile in both height and weight.
I feel stupid. I can't study. I can't concentrate. I have the attention span of a 2-year-old.
This is JJ, a kid who has always had a sensitive stomach. He is allergic to most foods with animal protein, milk, eggs, and meat. And as a small child, he was always coming down with an illness or another. And then a few years ago, something really scary happened.
When he was 11, he got sick with pneumonia. So he was home from school for a couple of weeks. Right after the new year, he seemed to be okay to go back to school, so I sent him back to school.
I wasn't feeling good. I was really lightheaded. I felt like I was going to puke. And so I went downstairs to the office and called my mom and asked her if I can come home because I didn't feel good.
So I asked my son if he was okay to walk home, and then I would meet him.
All of a sudden my legs went jelly and I literally fell to the ground and I couldn't get up.
It basically took me a good hour to get him home, which is only like a 2-minute walk.
I couldn't move them. It was freaking me out because I didn't know what was wrong.
No one understood why JJ had become wheelchair-bound. His condition remained undiagnosed for a year. During that time, he was homeschooled, too tired to attend class.
They tried to say it was MS. They just weren't sure, and they really didn't want to do anything at first until I fought and finally got him into Sick Kids Hospital up in Toronto.
When I got to Sick Kids Hospital, a lot of doctors, at least 20 of them.
They thought at first he had Wilson's disease. They knew it was something to do with the liver because the liver testing came back that it wasn't normal.
JJ's multiple neurologic, psychiatric, and digestive disorders worsened. He was bedridden and almost catatonic.
I didn't want to do anything. I just sat there and slept.
He was close to death because I was told that stuff was shutting down on him.
And this doctor came in and took my blood, and then he came back and said I had a vitamin B12 deficiency. And he was like, oh, thank God they found a cure.
B12 deficiency is dangerous because you have a window of opportunity to treat it. And if you don't treat it, you're going to destroy the myelin. Okay? And sometimes there's no recovery. That's why these people are in wheelchairs or bedridden or die.
To fail to find something that's easy to fix is something you try to avoid.
MS is a demyelinating disease, and so is B12 deficiency. You can't tell the two apart unless you test for that.
It causes neurologic disorders, psychiatric disorders, can cause people to fall and break their hips, can cause them to have dementia. It can cause cardiovascular disease, cerebrovascular disease.
Repairing the nerve damage caused by low B12 requires high doses of B12, often for the rest of one's life.
Like, at first I didn't think it was going to work, because I was like, I'm crippled for life, just deal with it. Then I was able to start crawling and move my legs, which is, I was like, oh my God, I can almost walk, and I was like freaking out. And a couple of months I was in a walker. That was pretty awesome.
If they've had damage for a long period of time, then they might not get completely better.
When I finally lost the walker, I felt normal. When I'm walking, I kind of lean forward, and my mom's like freaking out that I'm gonna face plant.
Very difficult to see a child to have to go through this, particularly, as I said, when it could have been prevented, and it wasn't.
But why wasn't it prevented? By the time anyone tested JJ's B12 level, it was 0, and he was very nearly dead. His death would have been recorded as some sort of multi-system failure of unknown cause, not the real cause, B12 deficiency, which is easily treatable if caught in time.
It's a knowledge deficit. I don't think they understand the disease. I think the name pernicious anemia is causing problems because they're looking for a severe deadly anemia, and many people don't get the anemia.
B12 deficiency may produce neurologic and cognitive change without producing anemia or even without producing large red cells.
One big reason for the missed diagnosis is that JJ's blood count, or CBC, looked normal.
They've been taught you have to have anemia and macrocytosis to have a B12 deficiency. That is completely untrue. You're not going to get macrocytic and large red blood cells because we have enough folic acid.
For over a decade, both the United States and Canada have fortified all flour products with folic acid, the synthetic form of folate, another B vitamin. For longer than that, prenatal vitamins have had high folic acid added to them. These well-meaning public health initiatives are meant to prevent neural tube defects in pregnancy. But folic acid and B12 are cofactors, and folic acid will correct the enlarged red blood cells that used to occur as a late-stage indication of B12 deficiency. Folic acid will not correct the neurological damage.
The B vitamins work synergistically together, especially B6, folic acid, and B12. They kind of went on this big campaign with folic acid, and they just thought that's the only thing with neural tube defects, but they forgot the B12, which to me never made sense because B12 is specific for the myelin that surrounds the brain and the spinal cord. I always remember this in nursing school thinking, well, why aren't they doing B12? Just folic acid, folic. It made absolutely no sense.
Prescient researchers warned public health officials that universal folic acid supplementation, which corrects the anemia doctors were taught to look for, is bad for people vulnerable to low B12 because it will hide their deficiency. Has this led to an epidemic of undiagnosed B12 deficiency and disease that could have been prevented? The mounting evidence-based medicine suggests the answer may be yes.
So with respect to the possibility that folic acid fortification has placed individuals who have B12 deficiency at risk and who therefore are now more vulnerable to the effects of that B12 deficiency, there is concern and growing concern that that may be the case.
Folic acid supplementation may be delaying the recognition in B12 deficiency by correcting the abnormalities in the blood without affecting the neurologic abnormalities.
Any severe B12 deficiency will cause neurological problems, and that is being masked by the illusion created by the folic acid ameliorating the anemia. So that's what masking is all about.
The danger is if you have a B12 deficiency and you mask it and it continues to go on, you can cause injury.
JJ has been permanently injured. He suffers from extreme fatigue and attention deficit in addition to neuropathy, osteoporosis, and pain.
I didn't used to have back pain, but now I do. It's like getting old.
Degeneration of the spinal cord. It's a form of B12 deficiency where it was left too long, so it's got a lot of nerve damage.
I can't use my hands at all. I can't run.
If you're normal, you should be able to say without a problem, my toe is down or my toe is up. With B12 deficiency and subacute combined degeneration of the spinal cord, that ability is lost.
How many doctors have ever even heard of subacute combined degeneration of the spinal cord, which presents on an MRI as a particular pattern of damage? How many know that this damage is treatable with B12 shots if it is caught in time? How many know that this damage is greatly accelerated when nitrous oxide is used in anesthesia because nitrous oxide inactivates B12?
Nitrous oxide is a very potent oxidizer of vitamin B12. And when B12 is oxidized, it's not able to act as it's supposed to in the various chemical reactions it functions in, and it can precipitate acute neurologic dysfunction in someone whose B12 stores are marginal.
Donald Jacobson of the Cleveland Clinic has been studying vitamin B12 for over 40 years. B12 deficiency was named pernicious anemia because until the 1920s it was an end-stage, incurable disease. Then researchers discovered that liver milkshakes would treat the disorder. What was it in liver that was saving people's lives?
The active principle in liver turned out to be vitamin B12.
B12 is the largest and most complicated vitamin molecule. Also known as cobalamin, B12 is the only vitamin molecule with a trace mineral constituent, cobalt. It is the hardest vitamin to digest and absorb from food sources. The only food sources of B12 are animal products, putting people like JJ, who can't eat meat, at risk for deficiency. JJ also lacks a protein called intrinsic factor that is necessary to digest B12. Dr. Jacobson explains that researchers first thought that intrinsic factor was the only protein involved in B12 absorption. But now we know there are many proteins involved.
There are at least 14 or 15 different proteins involved in this complex process. We probably are not getting enough of this important micronutrient.
In the last few decades, has a sort of perfect storm been brewing in terms of more and more people not getting enough B12? Cholesterol warnings have meant that doctors urge patients to eat less meat. More Americans have become vegetarians. Modern medicines that block the absorption of B12 are being used by vast segments of the population. These include metformin for diabetes, acid suppressants for heartburn, oral birth control pills, chemotherapies, and statins. The population is aging, and with age comes a decreased amount of hydrochloric acid, impairing a person's ability to digest B12 from food.
In many of these elderly populations, as many as 30% of people may have B12 deficiency or marginal B12 deficiency, or what's called subtle deficiency, defined by normal levels of the vitamin in the blood, but high levels of the metabolites methylmalonic acid and homocysteine.
Unfortunately, the reference ranges doctors use to determine how much is enough B12 were instituted when we thought B12 deficiency was first and foremost a problem with blood cells. The lower end of the cutoff still reflects when a person might develop severe deadly anemia, so-called pernicious anemia. But long before there will be anemia, there could be other problems from low B12. Problems that include epithelial cell degeneration, psychiatric distress, fatigue, neurologic damage, and circulatory issues, autonomic nervous system dysfunction causing tachycardia, dizziness, breathlessness. And then, as mentioned earlier, despite the warnings by B12 researchers, the U.S. has mandatory folic acid fortification of all flour products. Research shows that unmetabolized synthetic folic acid can build up now in the most vulnerable people and can worsen the nerve damage of a B12 deficiency.
So, for example, in the large N. Haynes study that came out of the group from Tufts, they showed that individuals with low B12 and high folate levels had more neurocognitive deficits than the individuals with low B12 without high folate.
If you treat someone who has B12 deficiency with folic acid, you can either precipitate neurologic abnormalities, or if the patient already has neurologic abnormalities, they can get much worse. So folic acid should never be given empirically unless one is sure that the B12 status is normal.
Who gets tested to see if their B12 status is normal? It is up to individual doctors to know that the rules have changed. But it is very clear that many doctors just plain do not know this, and therefore they may not be appropriately suspicious of the condition of B12 deficiency in absence of anemia. Psychiatric illness is not uncommon with B12 deficiency. It used to be called megaloblastic madness. What a doctor may not realize is that the psychiatric problems and the megaloblastic anemia are distinctly separate manifestations of B12 deficiency. You need not be megaloblastic to be mad from insufficient B12.
Perhaps historically, there might have been a belief that the severe anemia and the neurological manifestations, including sometimes what was loosely termed madness, was caused by the anemia. But that soon was replaced by a more rational recognition that these were two essentially separate effects of B12 deficiency. The effects on the blood and bone marrow on the one hand, and the effects on the nervous system on the other hand.
Before he started B12 therapy, JJ had unpredictable rage.
I could be like happy one second and like really mad for no apparent reason the next, or all of a sudden go mad and just start swearing.
When you're deficient in B12, it interferes with the production of serotonin.
You would think the standard of care would be if someone has depression, that a physician, a GP, internist, psychiatrist, the standard of care would be you would at least do a serum B12, and do other sensitive tests to back it up or to see if the person has it. And that doesn't happen. They'll give you an antidepressant.
It's actually very, very surprising on like one little thing could like mess up your whole life.
I had a woman the other month that was in her 40s. She was completely psychotic. The family called the ambulance because they're afraid she was going to injure them or herself. She was seeing a psychiatrist, numerous physicians on all these psychiatric meds. Her B12 came back extremely low, like 120. And her homocysteine had come back, was huge, was like in the 90s. That's high risk of getting vascular problems. So there's an example. In 2010, this woman had numerous physicians, long-standing psychiatric history, in and out of things in the ER to get medically cleared. All that money being generated, and this poor woman and her family, and here she has a significant B12, and nobody knows.
Many well-meaning practicing physicians simply think that this dangerous vitamin deficiency is a thing of the past.
I definitely remember myself feeling, oh, here's another placebo that people are just doing because they want to make themselves perfect.
But this widely held and erroneous assumption about B12 can be a serious problem, as pediatrician Dave Carr found out in 2005 when he became the patient.
I had no reason to suspect that anything out of the ordinary was going on other than that I was getting older. I also remember rounding at the hospital, and on several occasions I almost tripped. I guess we would call it foot drop, where the front of my foot went down when I was bringing my back foot forward, and I stumbled, and I did it twice while I was rounding, and I remember saying to myself, boy, getting old is sure a bear. Then I started noticing a little bit of loss of balance. At that point, I called an ear, nose, and throat doctor friend, and I questioned him about my equilibrium and thought that maybe I had a problem with my balance in my ear. He said, Dave, I don't think that's what it is. I think you need to see a neurologist. Several weeks later, I was in the office of a well-known neurologist, adult neurologist, and at that point he suspected that I had a condition called multisystem atrophy.
And the results came back that were just absolutely devastating. And the olivopontocerebellar atrophy is a death sentence.
By June of 2005, I was basically confined to my house in what my son calls my sleeping chair.
He was functionally blind. You would have to scream at him to be heard. He could whisper.
I remember having panic attacks. I remember my friend, the same Dr. Harvey Barnett, standing by me. My best friend's wife informed me later on that she went to one of my doctor's visits with me, and that my neurologist said to her, "Why don't you just call hospice and make him as comfortable as possible?"
He was rolled up in a fetal posture. His hands were retracted. His thumb was in between his ring finger and his middle finger. He was shaking uncontrollably, and it looked like he was freezing. He had lost probably 30 pounds.
I yelled at him, "Why don't you just let me die?" And he said because he couldn't, he put me in his car and he drove me to Shands Hospital in Gainesville, Florida, where I was correctly diagnosed with a vitamin B12 deficiency.
Dr. Carr was immediately started on aggressive B12 shots. Within 3 weeks, he began physical therapy with the friend who saved his life.
I returned to the office in March of 2006 in a wheelchair. I have since weaned myself off the wheelchair, and I am the most stable on forearm crutches. I learned a saying in medical school: when you hear hoofbeats, look for horses, not zebras. I think that most doctors, including myself, consider B12 deficiency as a zebra.
To know that this, in fact, was the proverbial horse and not a zebra, I felt personally responsible for missing this.
If my best friend had never picked me up, taken me to Shands Hospital where I was correctly diagnosed, I'm sure it would have gone down that I had died from a neurological condition, ignorance. I don't know any other way to explain me not thinking I had a vitamin B12 deficiency.
Patients can have severe neurologic damage without any telltale sign of megaloblastic anemia. To confuse things more, they can also have damage in the outdated, so-called normal range of serum B12. Eventually, the toxic metabolites homocysteine and methylmalonic acid will start to build up in a person who does not have enough B12. All these tests might have to be done to rule out a deficiency.
My doctor never did the vitamin assay.
His methylmalonic acid is up here, and his vitamin B12 level is down here. This is lethal, this is lethal.
Knowing what I know now, yes, it seems very odd that B12 levels are not routinely checked. I can only assume that it happens much more commonly than we would have ever imagined.
I think we don't think about B12 deficiency enough in the setting of neurologic, psychiatric, and cognitive disorders.
What I see is a kind of indifference and sometimes an attitude of condescending indulgence. Oh, there he goes on about B12 again.
A patient who is in a high-risk group, I would test. And by high-risk groups, I would include people who are on a vegetarian diet. I would test in people who had intestinal dysfunction, suggesting malabsorption, particularly problems with the stomach. Problems with the stomach include ulcers, not so much because of the ulcers, but because of the medications people take to treat those ulcers.
Proton pump inhibitors, Prilosec, Prevacid, Nexium, and physicians are prescribing that like candy to them.
People who were on the proton pump inhibitors were more likely to be deficient in B12 than the people who were not.
Any patients with a vegetarian or vegan diet or who don't eat a lot of red meat should be checked. I think any patients who complain of fatigue, paresthesias, numbness, tingling, any problems with balance, memory issues.
I don't remember the point that I stopped remembering things. I'm not sure if I remember a lot of the things that I've relayed to you today, or if I remember them because someone told me about them.
And he was very ill, and they thought he had leukemia, and it took him a month to figure it out. He was at Henry Ford Hospital in Detroit, and they figured it out that he did not have leukemia. They did a bone marrow. He had B12 deficiency, which was pernicious anemia. So I found out that I was B12 deficient myself when I was about 20 years old.
Sally Patchlock and Jeff Stewart are married health professionals who have witnessed so many cases of undiagnosed B12 deficiency in their patients, friends, and family members that they wrote a book in the hopes of raising public awareness.
She was so fatigued. She was having the classic B12 deficiency problems, gait problems, numbness and tingling, depression. She was going neurologically downhill. Now she's 45 and she said she was using a cane. She kept falling. They didn't know what was wrong with her. I don't know if they thought she was psych. One day she collapsed and she just like fell again and was hospitalized. And the reason they figured out that she had B12 deficiency was a pulmonologist, because she had pulmonary embolisms. They started to investigate why, at her young age, why was she having PEs. When he looked at her whole medical history of her falling and this and that and her blood tests, they tested her for B12, homocysteine, all that. And she had severe B12 deficiency, pernicious anemia, which for years she had this. And how she was getting a little B12 was getting blood transfusions, which is crazy. She's 10 years post her injury. She now uses lobster crutches to ambulate. She has urinary incontinence problems. She's got cognitive problems, because what it does, and you got to remember, this is a 45-year-old woman. This does this to elderly. We go, oh, well, you should be forget. She did have a malpractice suit. 10 different doctors were involved, 2 institutions, and she won. But the point of the matter is, no money in the world. This woman is physically disabled at 45 for the rest of, she's 55 now, for the rest of her life, and cognitively. Prenatal vitamins have high-dose folic acid. There is not enough B12 in a prenatal vitamin to prevent a B12 deficiency, and there are many reasons a young woman can have a B12 deficiency.
A young woman's B12 level could be taxed during a growth spurt when she hits puberty. At the same time, oral birth control pills can interfere with B12 absorption. A young woman may stop eating meat or have a fattish diet that is low in B12, or have an eating disorder. She may have her teeth pulled using nitrous oxide anesthesia, which will inactivate already low B12. And then a young woman in childbearing years may use vitamin supplements that are high in folic acid, but have an inactive B12 analog. Research shows that there are remaining neural tube defects that occur post-fortification, and they're associated with B12 deficiency.
Folic acid fortification has reduced the incidence of neural tube defects by about 30% in the USA, which is good but a little disappointing, because 70% of them remain.
Pregnancy increases a woman's B12 requirements because the fetus needs its mother's B12 for growth and development. So, during pregnancy and postpartum, these days it would not be surprising for a woman to be left with a masked B12 deficiency. This is even more true if she's breastfeeding and not eating meat. All in all, it could lead to a B12 crisis.
And I've seen a couple patients in the ER that had postpartum psychosis, and they were both B12 deficient.
That's well known. I mean, depression, psychosis, they should always be checked for B12. There are women who have actually killed their children or killed themselves. And you wonder, you know, they had that. Was B12 a cause? Nobody's testing. We don't even know the true incidence of B12 deficiency.
One of them had thoughts about wanting to kill her baby, and she was depressed about that. And she had just given birth a few weeks ago, and so we tested her, and she was positive. So I treated her in the ER.
In the United States, over 5 million vegetarians. And a lot of what happens with the children is that mothers who are pregnant, like say they've been a vegetarian for 10, 15 years and they get pregnant, and then their breast milk doesn't have enough B12, those children can become severely B12 deficient, and they can have a brain injury.
Lennon is 11 years old. He has brain damage that could have easily been prevented if his doctor had known the signs and symptoms of B12 deficiency. At 9 months of age, Lennon had dysphagia, that is, difficulty swallowing solid food. He then experienced failure to thrive and weakness and pallor. He was misdiagnosed by 3 pediatric specialists, including a pediatric neurologist, who told Lennon's parents that he had a rare and incurable neurologic disease of unknown cause. Sound familiar? Lennon started getting the right medical treatment at age 2, but by that point, some of his acquired brain injury was permanent.
Lennon is in 5th grade and he's in special education. One of the hardest challenges for him is his inability to stay on task and pay attention. Handwriting it's very, very difficult. He's not able to really write assignments of any length. He definitely struggles in school.
Lennon had been a typical happy baby until 9 months old when his eating regressed.
And our doctor assured us that Breast milk was 100% nutritionally complete. We were concerned about his development, that he wasn't able to really turn over good at 15 months, although he had done it before.
You know, he's a sack of potatoes. His head just flopping around. And we again expressed, you know, something is wrong.
Lennon had become an unhappy baby who was prone to infection and slow to heal. He acquired noticeable tics and repetitive gestures, as well as shortness of breath.
He would sit around and pull his fingers and do his lips, and we kept bringing it up to the pediatrician, and I think his response at that time was, well, he's not doing it now.
We trusted him. He was the head of pediatrics at a major hospital here in Birmingham.
By age 2, Lennon had severe neurological problems, and the family was told nothing could be done. Only after gathering his medical records did his parents realize that he was dying of B12 deficiency.
He had all the classic symptoms, you know, pale skin, pale lips, weakness, floppy muscles, I mean, you name it, he had it.
Lennon's B12, homocysteine, and methylmalonic acid were all abnormal.
Homocysteine, if your levels are over 15, you're at high risk for a stroke, heart attack, and his was 89.7. Basically, he was building up some toxins in his body.
As soon as Lennon was put on B12 shots, he began his recovery, and he began eating solid food.
After he had been on the shots, he was a happy baby like he had been early in his infancy. If you could tickle him, he was just happy.
There are kids that have autistic symptoms that are B12 deficient, and that's all. There are older people with dementia that are having symptoms of B12 deficiency.
Lennon couldn't walk till he was 2.5, and that was after being on B12 injections for 6 months. He started walking right around Mother's Day. It was the best Mother's Day gift you could ever hope for. And he potty trained at 4.5, but he had a lot of catching up to do. You know, we wish so badly that we would have, even at 12 months, just left our pediatrician. We'd known him for 20 years, so he was fully aware that we were vegetarians, as well as our OBGYN. He knew we were vegetarians. I took Centrum and I took folic acid and iron during my pregnancy. But that's, you know, he told me that was fine for me to take.
As far as I'm concerned, if you're deficient in B12, there is not enough B12 in a multivitamin. You need more.
You have to have over 1,000 micrograms orally to correct a deficiency.
You know, I didn't realize that I was B12 deficient, but in retrospect, once I was diagnosed and learned about it, I did have symptoms, but I didn't know what to attribute them to. I would feel like little electrical shocks going up my arm, like, you know, real mild, not anything, not constantly, but just randomly. And I would think, well, that was weird. Once I was on shots, that totally went away.
Lennon's new pediatrician took him off B12 shots as soon as his blood level returned to normal.
I noticed a difference in Lennon at that point. I called the neurologist. I said, I'm concerned. I can see a difference since he's gone off the shots. I called the hematologist and our new pediatrician, and nobody would put Lennon back on B12 injections because they said he didn't need them.
We check blood levels, and sometimes that's not the most accurate way of ascertaining whether a patient is B12 deficient. The tissue concentration tests are a bit more complicated to do. They're more expensive. And so in these patients, that's what you might be running into. Their levels look good on paper, but they're truly deficient. It's not getting absorbed into their tissues.
When you test for B12 deficiency, you may not get the right answer. Serum B12 can be very misleading. You may have all of your B12 on a protein called haptocorrin, which is not the general delivery protein. That means you probably have a deficiency of the transport protein called transcobalamin. And you can actually determine the total amount of unbound transcobalamin in circulation, a test called the UCBC, unsaturated B12 binding capacity.
Only transcobalamin 2 gets transported into your body, into your cells. It's only 20%.
I just recently found out my daughter's got B12 deficiency. Her B12 is low, so I've started her on the medication, and so far her migraines have gone that she was getting. The weakness of the legs are gone. She's not as tired. She's not as moody. They try to tell me that it's normal, that she didn't even have B12 deficiency. I know it's low.
B12 is needed for the brain, for growth. When children are B12 deficient, their brains aren't growing. Their head circumference slows down, their height and weight.
We didn't tell any of his teachers he was back on the shots because we just didn't want to say anything. Every teacher came to us, said his fine motor skills, he's better, his attention was better, he seemed happier, he was more sociable.
I've seen patients like this as well who were seen elsewhere and who had levels that fell within the reference range. I'm not quite sure what the best way to address that problem is, again, other than through education of the physicians as well as of the public.
To help educate the physicians and the public, Lennon's parents hosted a B12 awareness event at their art gallery.
Unbelievable how prevalent it is and unknown.
It's definitely more prevalent than we know. There are people that have abnormal values that you wouldn't expect.
There's like, I think 8 houses on our street, and out of those 8 houses, there have been 5 people diagnosed with B12 deficiency. There's a huge amount of people who are suffering who are not diagnosed.
There have been many, many, many more cases since we've been involved with this that have shown up. My dad's one of them. Balance became an issue for him and some forgetfulness and whatever, and he actually came to the vent, and as he came in, he fell down. And it was a battle to get his physician to even test him.
B12 deficiency really hits the elderly. They come in the emergency room and they fall. We should always check them, and so should their internists and GPs, etc.
There's no excuse to not screen for it. In the elderly, certainly not.
Elderly are known not to have enough hydrochloric acid, so they are at higher risk than the normal population to have a B12 deficiency.
How much vitamin B12 does it take to correct this abnormality? It turns out it's much more than one would expect. So an older person may require 500 to 1,000 micrograms of vitamin B12 in pill form daily.
B50 complex, that has 50 micrograms of B12. And when you look at the percent RDA, it says 833%. So you go, woo, like, wow, I'm having enough. But if you have a malabsorption problem, that's not going to do anything for you. You'd have to have over 1,000 micrograms, which you can buy like supplements.
I did not have a single nursing home patient in the 2 years that I worked in nursing homes who was taking an oral vitamin B12 supplement.
Low B12 levels are associated with a progressive cerebral atrophy that could contribute materially to cognitive function.
If someone has dementia and any test abnormality that raises the question of B12 deficiency, be it a low B12 level or an elevated level of homocysteine or an elevated level of methylmalonic acid, I believe that person should be treated intensively with parenteral B12.
B12 is very, very cheap. A shot costs like not even $1. You could treat somebody for an entire year for with $36.
Failure to treat early and aggressively might lead to irreversible loss of mental function.
Whether or not damage already done will be reversible will depend on duration and severity.
If you find B12 deficiency before it causes problems in patients, you save the insurance companies a lot of money because, yes, absolutely, patients can fall, they can have, see a neurologist, get a whole slew of tests, including MRIs and EMGs, and it's a simple answer.
I was surprised to find my mom was positive for B12 deficiency. She had a tremor in her arm, and she went to a neurologist, and they did MRIs and CAT scans, EMGs, and all that kind of stuff on her. And they diagnosed her with essential tremor and put her on, I think, myceline, which is an anti-seizure drug, which made her dizzy on top of having an arm shaking. And so Sally said we should test her, so we got her blood and urine and tested her, and she came back positive. She's on thyroid medicine, so she's thyroid deficient, so it's another autoimmune disease which can go along with it. She had abnormal pap smears for years, and they wanted to do different procedures on her. I think they did do some procedures on her, and once she was diagnosed and treated for B12 deficiency, all of her test results from that time on came back normal.
It's called dysplasia, cell changes that are an early form of precancerous lesions. Low B12 can cause dysplasia in many tissues, putting its victims at risk for cancer. Nobel Prizes have been awarded to scientists for their work in B12. Its discovery and synthesis was nothing less than amazing and life-changing for so many people. Finally, doctors could easily treat and cure B12 deficiency. After B12 became available, many family doctors found they could use it to treat fatigue and mild depression, and many patients would report how much better they felt when they got B12 shots. No blood work was done, nor any disciplined research. But then in the 1980s, the DRGs came out. The DRGs, or diagnosis-related groups, assign a number on every medical treatment for insurance and hospital record keeping. For what seemed like very good cost-saving reasons, insurance companies stopped covering B12 injections, except in confirmed cases of classic autoimmune pernicious anemia. Almost overnight, doctors went from liberally using B12 shots to denying them to their patients. Sophisticated and well-educated doctors did not want to be accused of trafficking in something that no one had bothered to prove wasn't a placebo. Patients who had felt fine with a periodic B12 shot were now told their symptoms had to be psychiatric in nature, unless they developed enlarged red blood cells. Cell size is a late finding, not the first sign of B12 deficiency, and if you also had iron deficiency, which causes small cell size, that might confuse things by normalizing cell size anyway. And now, folic acid fortification has taken away the late finding, the only finding that many physicians were ever taught to look for. What have the unintended consequences been? The answer is we do not know, but plenty of people are worried because the statistics from the CDC are worrisome. For example, the incidence of every single neurodegenerative disease has gone up. Everything from essential tremor, Parkinson's, MS, multisystem atrophy, macular degeneration, autism. Is it just coincidental?
The neurological manifestations well precede the hematologic manifestations. That's why we are missing patients and we're causing neurologic injury. And we're costing a lot of money. Billions of healthcare dollars are being wasted because we're putting people on antidepressants, on dementia drugs. We're giving Procrit for anemia. We're giving blood transfusions. Patients are coming in because they're having balance and falls and they fracture their hip. When you fracture a hip, it costs over $50,000 from the time you fall at your house, get an ambulance ride to the ER, you have surgery, and you go to rehab within like a 2-month period. That's $50,000. Dementia, cognitive problems. It costs $60,000 for someone to be in a dementia ward nowadays.
No doctor wants to let something that is easy to treat progress beyond repair. When B12 deficiency goes untreated, it is, as Sally Patchlock says, a sign of a knowledge deficit.
The doctor that misdiagnosed me was sued for malpractice. Yes, I won.
Perhaps the growing number of lawsuits will be the action-forcing events for a change in the standard of care. The stakes are high because untreated damage is permanent. How many elderly people are demented and in wheelchairs and diapers from nerve damage and with heart disease and autoimmune dysfunction and atypical cells and DNA changes because of their unchecked, slow and steady loss of B12 and rising homocysteine and methylmalonic acid? We don't know.
In medical school, I think we had half a lecture that covered B12 out of all the time I was in medical school. And that just consisted of macrocytic anemia.
B12 deficiency is such an insidious disease. I mean, all the symptoms creep up very slowly. So you don't recognize them, and I didn't recognize this in my daughter. And it wasn't until a co-worker, whom she didn't even really know that well, and he said to her, he said, "What is wrong with you?" He said, "You look awful." He said, "You can almost see through your skin." She would tell him tell the doctor how tired she was. And they wouldn't listen. They would put it down to depression. Even after she was diagnosed, and we weren't certain of the treatment, she wasn't responding to it. It was because she wasn't getting enough B12, but we didn't know that. She cannot go a month between injections. So she self-injects weekly. She needs that level in order to have a good quality of life, and that's what it comes down to.
The CDC has a physician continuing education course on its website. warning doctors to keep B12 deficiency on their radar screen. Laboratories that do serum B12 testing now send alerts to physicians flagging B12 levels in the low range of so-called normal to warn doctors that our current reference ranges do not rule out B12 deficiency and that higher levels can be associated with neuropsychiatric and circulatory problems. Not everyone is up to speed on the urgent need to be vigilant about B12 deficiency. One of Tori Gardner's doctors just laughed at her and said, "Why do you think something is wrong with you?" Well, in fact, a lot of things were wrong with her.
I've been biting my tongue because my tongue is swollen. And I feel like I'm really hungry, but I take a couple bites and then I'm full. I feel stupid. I can't study. I can't concentrate. I have the attention span of a 2-year-old. And I would get dizzy and I would have to sit back down. Or I would get up and I would find myself in a different room but not remembering why I was there. Like I would just sit there and scratch in class, and I would try to not because I was so self-conscious of it. It actually felt like something was hatching in my head, worms.
Tori grew up with horses and she was once a trick rider in rodeo shows. Today, she hardly has the energy to feed her horses, much less ride them. Her health history is long and complicated, as is typical of undiagnosed B12 deficiency. At the end of her second pregnancy, she developed preeclampsia. Her son was premature and had a congenital malformation of his heart and failure to thrive. Research now shows all of these can be caused by low prenatal B12. Tori had bowel problems and then colon surgery. She developed extreme irritability and mood swings so severe she says it destroyed her second marriage. Now, with her children grown, Tori recently went back to school. She lives with her boyfriend Jeff and things have been going great until she suffered a pulmonary embolism, and just recently she woke up with an essential tremor.
By the time I left for work, it was in my voice and I sounded like Katharine Hepburn. And my chest was just pounding. Doctor came in and what he said to me was, "Tori, what I think you have is you're having an anxiety attack. And I am going to give you something to calm you down. And then we'll talk later." And I said, "An Ativan." I'm not having an anxiety attack. I am in the middle of a bachelor's degree in psychology. Trust me, I woke up like this. He got his chair and he sat down and he says to me, "What you have is post-traumatic stress disorder." And this is after spending less than 4 minutes with me. A few weeks before, she had diagnosed me with lymphocytic colitis, which is a little sister to Crohn's disease.
That's when she learned she should be tested for B12 deficiency.
And there was like 35 symptoms, and I hit 27 of them. And I thought, you know, this could explain everything, even the colon problems. And I went in that day and I had my blood drawn, and nobody called me back until I had gone to the emergency room. Because I told him I had some labs and could he look them up. And he said, "Well, your vitamin B12 is at 74. And at that point, I didn't understand in any way what that number meant. She takes one look at me and she says, "Oh my God, what's going on?" And at that point, my tremor was way worse than it is now. And I said, "I don't know, Dr. Van Amberg." And I started to cry. And I said, this isn't normal. You've been seeing me. I've not been like this. But yet I go to the emergency room and they tell me I'm crazy. And I just got done at a neurologist's office who told me that I'm post-traumatic stress disorder and that I need to see a counselor immediately.
In fact, Tori's B12 level at 74 was incredibly dangerously low. Her homocysteine level was dangerously high, putting her at risk for cardiovascular disease.
Chest pains for years, stabbing chest pains, just horrible things that lead me to believe that I've had this for quite a long time.
Despite her digestive problems, her dangerously low B12, her high homocysteine, her tachycardia, her fatigue, and her orthostatic problems, doctors were quick to dismiss Tori as crazy and malingering. She's getting appropriate treatment now. Can she turn back the clock on injury?
I've only been getting this kind of shot and in a regular basis now for about 2.5, 3 weeks. And we did 1 week of every day. And that's when I started to see something happening. On some days I don't tremor at all. My mood is better. My attention span is better. I have energy for the first time in months. Jeff had to work, and I actually got up and I steam cleaned my carpeting in the house. And my bathrooms were clean, and my kitchen was clean, and the dishes were done. And I, you know, Jeff came home and he said, "Oh my God, did the gnome arrive?" And I said, "Yes, apparently the gnome arrived and gave me a vitamin B12 shot because look what I've gotten done."
Over and over again, the beginning is part of the end. Over and over again, the beginning is part of the end. Over and over again, the beginning is part of the end. Over and over again, the beginning is part of the end.